Meeting for Tuesday. Oh, didn't realize we weren't recording yet. All right, so I'm calling us to order. This is the Salt Lake City Human Rights Commission regular meeting, Tuesday, June 6th at 5:37. And we'll take roll. Who is in attendance? I'm Jason Wessel, the chair representing District 1. Let's go to David.
David Lita, representing District 6.
Will. I think you're muted, Will. Can you introduce yourself for the minutes?
Will's video is also off. He may have stepped away for a minute.
Okay, then let's go to Everett.
Oh,
Hi,
there
I'm
he is.
here, and I keep my video off mainly because it doesn't really work for me. So I figure you guys are okay.
No problem. Just
Okay.
vocally for the record, we'll have that you're in attendance.
Yep.
All right, and Will?
Present.
All right, that gives us quorum. Do we have anybody else?
No.
All right. I'm the only one in the room on the commission, but we do have staff. If you'd like to introduce yourself.
Yes, Michelle Mooney, Salt Lake City Mayor's Office, Equity Manager.
Maria Romero, Executive Assistant to the Chief Equity Officer.
And our guest.
Mo Hickey, Voices for Utah Children.
All right, let's go to the agenda.
I printed it on both sides.
Okay, that's fine. I was like, whoa, James Straight. Okay, after welcome, that takes us to number 2. We've got approve and adopt the minutes. So hopefully everybody got an opportunity to look at the minutes for May last month. Entertain a motion to adopt the minutes.
So moved.
All right, David Lita has made that motion. Do we have a second?
A second.
All right, Everett Bacon has seconded that. Going to see if there's any objections. I'll say without objection 3 times. If there's no objections, the motion will pass. So without objection, without objection, without objection. Okay, I'm going to rule that the motion has passed without objection. That takes us out of voting procedures and back to informal, unmoderated debate. So at this point, our agenda allows for public comments. We don't have any members of the public in the room. Are there any members of the public online?
No.
There are none online, so we will skip item number 3 on the agenda. That will take us to our presentation. Mo Hickey, Executive Director of Voices for Utah's Children, is here to provide a presentation. So I will hand it off to you, Mo.
Thank you.
I will pull it up for you here too. Is this the best way to do it? Right? This is just the camera link. Okay.
Okay. If you handle the slides, we'll go from there. So maybe a little background. Voices for Utah Children, this is our 30th anniversary coming up this September. It was started by 3 women in Utah who believed that children's issues were not getting enough priority at both the state and the local level. We advocate primarily for the 0 to 18 population. We do go outside that at times when it's related to prenatal care. We do some work with juvenile justice and foster children, especially foster children that are aging out. We provide some advocacy on their behalf, but the primary focus is 0 to 18. We have a number of different policy areas we focus on, and we'll go through them as we go through this, but just as an overview, early care and learning, healthcare, juvenile justice, economic and family stability, and immigrant and refugee family policies. So in the presentation, this is actually brand new. You're the second group that's seeing this. We've decided after the past legislative session, we looked at the way things were being managed at the Capitol, as well as how issues were moving. And really looking at our work, we decided to go on two different fronts. One would be, we'll still continue to work with the legislature, we'll still work on statewide policy, but really, we need to start looking at the local community level, whether it's at the county level or the city level, which is where we feel we can actually make some strong inroads immediately in certain areas that could lead to bigger policy wins moving forward if we can build up a strong enough base. So where we're going to focus more in the coming years is going to be looking at upstream solutions for children. You know, Utah, if you look at the numbers, and I'll leave some books with you, Michelle. We publish a book every year, which is our Kids Count Data book. And it breaks down by county a number of different areas. And Utah performs well in certain metrics. But where we're really concerned is, for example, on childcare. Utah's, if you combine access and affordability, we're one of the bottom 3 states in the country. Pre-K, we're currently ranked 44th in the country. We still have the highest rate of teen suicides per capita in the country. We did have some wins last year. We passed a bill that we had been working on for a number of years called the 100% Kids Coverage Bill. That was so that all children would have access to some form of health insurance. That was probably what sparked my interest in going more local, because we had to fight the horrible word Medicaid, and that it was going to be for all children, regardless of parents' work status or immigration status. And we had to settle with a new product that's a chip product, so that there would be some safeguards in place that made most of the legislators comfortable with the rollout. That being said, that will allow all children in the state of Utah to have potential access to health insurance. Right now, Utah is ranked 14th in the country in terms of health insurance coverage for kids. We think this could move us into the top 3 or 4 rankings in the country if we can get the rollout done properly. We're also concerned.
Hey,
right
Mo,
now-
can I interrupt for just a second?
Sure, yeah.
Is that full health insurance with no deductible? I mean, what's the cost
No,
to the parent
chip,
from that?
the chip will have an income-based premium attached to it, just like the regular chip product. And there will be some small deductibles and copay. They wouldn't go for a full Medicaid package to start off with. So that was what we agreed to go with, just to make sure that there was some access. Now, some of the families, going into the session, we had about 82,000 children that were uninsured in the state. Out of that 82,000, 90% of them were eligible for conventional CHIP or Medicaid. So part of it was getting families enrolled in a product that they were eligible for. And this new product will be for the balance, which primarily will be made up of undocumented or mixed status families. One of the things that's kind of unique to Utah, and I apologize, I'm originally from New York, so a lot of it's unique to me, is about 55% of our children that are eligible for CHIP or Medicaid are actually rural white youth in Utah. The barrier we face there is that anti-federal mentality, or the pull yourself up in the bootstraps mentality, which is we don't want to take assistance, which is how they look at Medicaid. So we're doing a lot more outreach into those communities directly to say, no, this is what it is, this is why you're eligible for it, and you should be taking advantage of it. One of the things that doesn't get talked about enough in Utah is Medicaid accounts for about 21% of our overall insurance for the whole state. So it's a valuable resource. You know, it's hard to explain to certain people that we pay for it with our federal tax dollars. It's not a giveaway, so that we should be taking advantage of getting people signed up for it. So we're excited about it, but I'm also concerned because during COVID, we had a Medicaid expansion, which allowed nobody to be let go from Medicaid. We made inroads during that same time frame. So previously, Utah had a month-by-month Medicaid program, which was if you picked up an extra shift at work or you got a promotion at work, you were in danger of potentially losing Medicaid because you were above the income threshold. If it was because you picked up an extra shift and then the next month you were going back to your normal work, the average time to get back on Medicaid was 2 to 3 months. We were one of the few states that had that requirement. That's changed now, so we'll have annual coverage. So if you're enrolled on January 1st, you're good till December 31st, which is a big step forward, at least in continuity of care. So what we're concerned about now, though, with the unwinding is that everybody has to re-enroll for Medicaid. And Department of Health and Human Services is engaged in the rollout. So far, we're impressed. They've been very transparent. They seem to have a good grasp on what needs to be done. Now the question is, can we get the work done? And what that means is every family has to reapply. They have to go onto their account. They have to go through all the paperwork again. And that's going to be cumbersome. And the one thing we like that they did, especially in terms of families, is if they looked at the person's account and thought there was a high probability that they wouldn't qualify for Medicaid in the unwinding, those were the first people that were getting their notification. So the families that would still qualify are going to be getting their notifications later or their enrollment later. It's a month, they're doing it month by month. So the last 3 months of the year are going to be very telling. These are the families that should qualify, that need it. The question is, are we doing enough outreach to get in front of them to let them know what they need to do in order to get back on and get their coverage in place? So that's one of the areas where we're really concerned. For people online, I'll leave these books with Michelle, but it breaks it down by county. And in our presentation, we talk about all the issues in the different areas, whether it's early care and education. When I mentioned childcare earlier, and please stop me at any time if you have questions, but childcare is, it's a major economic problem, but it's also a humanitarian problem at the moment in Utah. Right now, where we're sitting, the average cost of full-time childcare for a 0 to 3-year-old is closing in on $12,000 a year. If you have 2 children under 5, you probably have to make about $36,000 pre-tax to cover the cost of just childcare, if you're paying full freight. That's if you can actually get in. I unfortunately spent some time up at University of Utah Hospital lately, and the doctors are now not able to access childcare. They just can't get their kids into childcare. So we're going to start hearing that more and more. It goes across all socioeconomic classes. I live up in Park City, and a year ago we have a childcare program called PC Tots. They have 107 slots. They had a 45-person wait list last year. Now, as of last week, they have a 237-person wait list and the same number of slots. And they just increased their prices. In some cases, because it's a sliding scale, some people are going to be paying $1,000 more per month for that childcare if they can get their child in. So we're seeing this become a problem across the state. When it's related to Salt Lake, what we've been trying to tell people, it's a universal problem statewide, but we have to come up with local solutions. What works in Salt Lake is not going to work in Box Elder, or what works in Park City is not going to work in even in Heber, even though they're right next door to each other. So,
So Mo,
yes.
is the absence of adequate childcare and childcare facilities due to inadequate, I mean, there's obviously demand. And it sounds like it's pretty price inelastic. In other words, you can almost raise the price and people will pay it just to get their kids in childcare. That there's this limitation on that, I understand. But what's the reason, in your opinion, that we don't have enough childcare workers and facilities? Is it we're not paying our childcare workers enough? Is it a permitting and licensure barrier? What is it, in your opinion, that needs to change to make more childcare available?
Probably a little bit of all of the above, but I'll answer both of those. So in terms of the pay for childcare providers, the average childcare provider in Utah right now is $14 and I think 12 cents an hour. That's the average pay. I always tell a story. My daughter was working in doggy daycare up in Jeremy Ranch area, and she was getting $22 an hour for doggy daycare when our preschool and childcare providers were averaging $12 an hour. So part of it's priorities, right? But the other thing is some of the restrictions or regulations are needed, but they're cumbersome. So depending on the age group, if you're working with 0 to 3-year-olds, you have a much higher ratio, lower ratio, sorry, in terms of numbers of children allowed to be given care by one person. So it's 3 to 1. You know, as you go up into our schools, we have no real restrictions on how many kids can be in a classroom, but childcare is heavily restricted on that end. There's also requirements, safety requirements, which are all good. The problem is we haven't taken a collective approach to look at some of this. There were some baby steps this year in the session. For example, up until this year, we were not allowed to convert government buildings into childcare facilities if they were not being used. There is a new bill that got passed, so that's allowable now. And so we can look at even some schools that possibly are being closed in certain areas that could be turned into childcare facilities, in theory, if there was a will and funding behind it. But the other thing is, it's, you know, if you're sitting in a preschool, you want to work with children, and you're sitting there going, okay, I get paid $14 an hour to work in the preschool program, or with my same degree, I can be a kindergarten teacher or first grade teacher, and I'm going to start off at $50,000 a year. The demand goes in that direction. And given that we have a shortage in K-12 teachers, it's not helping the situation. So there's plenty of openings in the K-12 slots if somebody has a degree requirement that goes along with it. So, you know, one of the things that's we struggle with is how do you come up with a solution that's fair and equitable, that opens up enough access for people across all economic levels, as well as provides a safe, nurturing environment for the children. As an organization, we believe that's where we should be investing more money, because the science now shows, and we've been working with the University of Chicago and the University of Utah Pediatrics, that the brain development starts at birth and changes start happening immediately. And you know, we're missing out in Utah in particular. We've invested very little money in the first 5 years, which are the key years in terms of development and growth. People used to think it was around 5 or 6 years old. Then they thought it was 3 years old, but now it's proven that the brain starts changing immediately, and there's reactions that start taking place. So we have to look at that and say, for the long-term good of the state, we have to start investing money there. I'll backtrack a little bit. We're the youngest state in the country. About 30% of our population is under 18, and the largest subgroup of that group is 0 to 6. So we're going to be a young state for my lifetime, and we're going to be facing these challenges. Now, During COVID, there was a lot of ESSER money and ARPA money that was put into programs like early childhood. Again, with all this unwinding, and I'd be really concerned about it in a place like Salt Lake, because I know there was a lot of money allocated towards different childcare programs and subsidies. But we're going to miss out on about $275 million in subsidies at the end of this year. And there's no plan at the moment that we've heard of coming from the state level on how we're going to supplement that, that revenue or that funding. So you're going to hear a lot more closures, we believe, unless that there is some subsidy or some stabilization grants coming in, which is just going to exacerbate the problem because we've already started seeing smaller entities close because they just can't keep open given current situations in terms of their funding model. So it's a big concern. We're actually working with the Salt Lake Chamber at the moment. We just published a report with them and the Gardner Institute. Lack of childcare access in Utah is costing the economy about $2.4 billion a year. So that's what I said earlier. It's both a humanitarian issue and an economic issue. And I apologize to the males in the room, but this has become an issue for females in the state of Utah. There's still this belief that it's a woman's job to be at home. I get told that directly to my face up at the Capitol. We are a data-centric organization, so I can tell you that we've gone from about 8 years ago, we had about 38% of families with a child under 6 had both parents in the workforce statewide. This year, we're slightly over 55%. So as the economy's gotten better, families, especially on the lower income side, have had to have both people in the workforce. They're not necessarily working the same shift a lot of times. One's working at night, the other's working in the day. They're making ends meet. But the reality is it's not like it was even 8 years ago, never mind 20 years ago, when grandma lived next door and an aunt lived down the street. We just don't have that same ecosystem in place anymore. So that's
Hey, Mo.
one of the other problems. Yes.
In light of the shortage for labor in the state, and the very, very low unemployment we have here, are you finding that employers are stepping into the breach and providing childcare in order to get workers?
Some are starting to. Some are realizing the question you asked earlier with the regulations and everything, how difficult it is, because they're subject to the same regulations if they offer it as a public benefit for their employees. We're concerned from the historical perspective. It's kind of like employee provided insurance and certain benefits, right? Is it a benefit that all employees can have access to? Is it, you can't leave your job if you get childcare at that job? Are you willing to take another job at maybe a better pay where you're not getting that benefit? So there's a lot of decisions that go into that. I met with one of the big tech companies about 6 months ago who was looking at it. And my pitch was, wouldn't it be much better if you paid a slightly higher corporate tax and that money was put into a pot where we could actually develop a childcare industry? And when they looked at all the questions that they have to answer, if you have a tech company in Lehigh and you want to provide childcare, do you know if the primary caregiver is in Lehigh? Or do they work at that company? Or is it the spouse that works at that company? Who brings the child to childcare? Is it 24/7? Because people work all different shifts. So there's a lot of intangibles that have to be answered for companies to do it. More and more, we're finding if we can get in front of companies and even people with the chamber, they are more open to the idea of a dedicated tax fund if it would be set aside for childcare, so that in some ways they get the burden taken off of them. But in other ways, it's a benefit that their employees can take advantage of without them having to run the program and manage the program. So there was actually an article in Utah Business, I think today, about companies that are starting to step into the space. But it's also raising a lot of questions that I brought up earlier, like who gets it? Is it for just the executives? Is it for everybody in the company, who determines, is it a lottery system? There's a lot of issues that go with it.
So that puts it back then to, if you're asking companies to pay a higher tax burden, goes back to a legislature that is adverse to raising taxes for anything.
And there's the circle, right? One statistic I found interesting last year, we were looking when they were looking to cut taxes. Individual income tax in Utah last year, all the people in this room, we paid about $9 billion in individual income tax in the last fiscal year. Corporations in Utah combined paid $700 million. And I will argue with anybody. I was on a panel at the Wasatch Economic Forum last week. The main beneficiaries of having a childcare system that actually works are going to be businesses equal to the family. So there is a role for businesses to play in this. There's a role for tax in this. It's something that we just have ignored far too long in this country, never mind in the state. One of my favorite stories is the last time we had federal childcare reform was 1973, and it was comprehensive childcare reform. And the Senate passed it with over 80% of the votes. The House passed it with over 80% of the votes. And this name might mean something to some people, but Pat Buchanan convinced Richard Nixon that we were going to put children in camps and indoctrinate them. So Nixon vetoed it the next day. And that was the last time a bill got to the Senate and the House on comprehensive child care. So long overdue, that's 50 years ago. And it's something that I really think as a state, it's even more crucial for us because of the age demographic that I talked about earlier. I'll move on and then I'll take questions. You know, I talked about healthcare earlier. We had some gains this year, so there was postpartum extension coverage for parents of mothers in particular. We used to only provide 2 months postpartum coverage. Now it's 12 months. We're going to come back this year and try to get that amended to postpartum coverage for as long as the mother needs it. We'll see if we can get that moving forward in that direction. I mentioned that children will have at least 1 year of insurance continuous coverage. Some of our surrounding states are now going to 0 to 6. So we're going to push for that, so that I would love to see that every child who has insurance has it until they're 18. That would make a lot more sense. Talking to pediatric offices, talking to hospital systems, everybody feels we'd have better outcomes if families knew their child was insured continuously. They would go for their wellness checkups, they would go for dental checkups, etc. On the healthcare side, another big concern of ours is, as I mentioned earlier, not just teen mental health, but mental health overall. In talking to a lot of the school districts this year, we're seeing mental health related issues as young as kindergarten. As a matter of fact, in the Canyon School District, it was the kindergarten class that had the most emergency calls this year. We're also seeing, as we bring more refugee families in from war-torn areas, that the children have been raised in violent situations, so they act out in a different way, and we're not providing those services for the schools. My cautionary tale with mental health, and I've had this conversation with the team up at the Huntsman Mental Health Institute, and full disclosure, my wife is a forensic psychiatrist, so I hear it at home all the time too, is we are probably, if we're lucky, and everything that we hope the Huntsman Mental Health Institute will accomplish, we have such a shortage of providers in the state. We're about 10 years out from meeting the needs and the demands across the state at the moment. So we have to come up with some creative solutions, how we can bring services into schools. And there are some things we can do there. If any of you are involved in education or have children in the system right now, the electronic network that was set up by Utah is one of the best networks in the country. It reaches every public university, public health clinic, public library, and public school. About 3 years ago, it was licensed for telehealth. So it's now, we could provide telehealth directly into the schools, into the counseling offices. We have a few schools that are piloting programs right now, so we're hopeful that we can expand that a little bit. If nothing else, even to just do med checkups for kids so that it takes the burden off the psychiatric offices so that they can actually give care to kids that might be in trauma or emergency at that time. And we can have physicians' assistants or nurses do the med checkups directly into the school. Plus, there's a higher probability that kids will stay in the building if they just go down to the counseling office for a med checkup. I know my kids, if they went for a doctor's appointment, were not coming back to school that day. They were out for the day. So that's another side benefit we think we can get there.
I've done teaching, and in the elementary school level, there is a certain cohort of parents that are object to the idea of having schools fill the void when it comes to mental health for children. They just absolutely do not want, don't think it's the school's role to be talking about their feelings, about the children's mental health, about basically anything that involves mental health is off limits for schools in their eyes. So how do we combat that kind of attitude?
Well, in a perfect world, I'd like to go the way we used to be, which is you have to opt out, not opt in for any kind of services. I spent 2 terms on the Park City School Board, and that was probably the one thing I lost that bothers me to this day, which was when the state went to an opt-in procedure. It used to be if you didn't want to participate in something or you didn't want to take advantage of services the school offered, you opted out. And it usually was about 2% of the population. Now you've got to get everybody to sign in to do anything. There's a third part to that group, which, so you have parents that, social emotional learning is a bad term, equity is a bad term. So you have that group. Then you also have another group, and I was surprised when I heard this, and this was in the Kenyon's district when some people were trying to talk about splitting up the district again. It was, well, I can afford to send my child to a mental health professional. Why should we provide it in the schools? And it's like, okay, well, maybe not everybody can provide, can do that or can have access. As I mentioned, I live in Park City. Right now, the only children that can be dealt with in the school by a mental health professional are kids in trauma. That's how many of them there are. So anybody who's like, just feeling depressed that day or, maybe borderline is not getting services. So it's a fight we're willing to take on with that certain group of parents. I agree with you, they're out there. Science doesn't seem to have a place anymore in how we deal with some of these issues. But what I'm really concerned about are in particular, the children that do not have access to the services. And, to be fair, there are also some cultural barriers that we have to face with different communities as well. That it's frowned upon to look for mental health services. Sometimes some of these issues are not just, it's cultural as well in the school. And if we can work with the schools on some things that are working. But one of the areas we started a conversation, so we
say more than just cultural based, it's gender based.
Yes,
Men do not want to talk about their mental health.
absolutely. No, and then you go back to, we have a legislature that's made up of majority old white men who were raised with the belief that this was not an issue that had to be dealt with, et cetera. So but again, we go back to data. Like we'll start all of our conversations with the data, which is if we have the highest rate of teen suicides per capita in the country, we have some problem here. So let's talk about what that problem is and how we can start addressing it, hopefully at a younger age. Now, I try to be nice sometimes with the governor, but the governor believes that, by banning social media now, we've solved the problem. So, don't worry about it, it's done. And anybody that's in mental health, and I will agree with them, social media is a part of the continuum that has to be looked at. Like, what is the effect of social media on children? But there are a lot of countries and a lot of other states that have social media that don't have the same issues we do as far as teen suicide, et cetera. So I prefer if we look at the whole situation and then started coming up with like pieces that all fit together, where social media might be a piece of that, but it's not the ultimate. By banning social media in schools, we have not solved the problem. And we've been having that argument behind the scenes for about 9 months now. And to be fair, we're not getting too far in it, but that's just an issue. You touched on another issue we're really concerned about, and it's perfect timing, juvenile justice. There were a lot, Utah was actually getting national accolades for advances in their juvenile justice program going back the past 5 years. We had a lot of restorative justice programs being put in schools. There was a lot of resource officers being reallocated, so police officers in schools being reallocated to different positions. And then came COVID, and we tend to have the knee-jerk reaction, so our truancy rates went up. Chronic truancy went up across the state, so therefore it had to be because we put in all these liberal policies that were allowing kids to just run free. So this year we took a step in the opposite direction, which was let's try to reinstate punitive laws. So for example, they wanted to have one, if a kid was caught smoking, that they would be put in juvenile lockup. Going back to really old laws. And the reality is, when we're talking to different, again, school districts across the state, it doesn't matter if it's rural or urban school districts, there are a lot of factors that have gone into truancy. Like, you can't just say it's because of this. If you go, like I was talking to the superintendent up in Juab. Juab has the least educated adult population in the state of Utah in terms of degrees, et cetera. His big struggle is when the kids don't go to school and they call the parents are like, well, they're going to get their high school diploma, so it doesn't matter. So no support on that side. So totally different issue than we might be seeing in a place like West Valley or a place like, Grand County. But it's something we agree, the chronic truancy piece has to be looked at, but again, let's look at the whole thing and say, what is causing some of these problems? We know that because of an increase in some families going into poverty over the past couple of years, that we're seeing older children in the family leaving school and going to the workforce. One worrying trend we're seeing nationwide is, I think it was Iowa and Arkansas, Alabama, I think, have just changed their laws that you can start working at 12 years old now. As somebody said the other day, that'll be coming to Utah within the next 24 months because it's a national movement. But again, in some of the rural communities, you have like, go work on the farm, the family needs you. In other communities, people are struggling to make ends meet, pay their rent, pay their mortgage, whatever it is. So that's just one piece of it. With some of the younger kids, they're being left in care of their older sibling because both parents, as I mentioned earlier, are working. If the older sibling doesn't get up to go to school, the younger kids don't go to school, and you have this snowball effect. So again, things we're concerned about, but what I'm really concerned about in the juvenile justice area is I don't want to see us go backwards where we were making a lot of gains. We had a significant decrease in kids that were in juvenile lockup. We were hearing better outcomes at the school district levels. And then during COVID, the tone changed again. So we have to keep an eye on that. Immigrant family policy, I'll touch on that briefly, and then I'll talk about Salt Lake and then take any questions. I won't take a beautiful night. But immigrant family policies, we carved this area out about 2 years ago as a separate policy area, and we're adding refugee families to it now as a more concentrated effort. All of the work we do was taking into account the immigrant populations and the refugee populations, but we really felt that by separating it out as a policy area, it would keep it at the forefront of the work we do. So we've done a lot of work. We started off doing work in DACA. We actually had some private donors that had come to us and asked us if they could work with us. So we were paying for DACA applications. We processed over 500 of them, 550, with private donations. But We've stopped that program now because we're not seeing any movement on DACA, and most of the DACA recipients are now 27 or older. I bring that up because everybody who works in a school system should be very concerned about that, especially a place like Salt Lake School District, because any child that is undocumented under the age of 27 has nothing they can apply for at the moment, and they're in this no man's land, and it's really concerning what their future could hold. So we worked over the past couple of years with University of Utah and higher ed to make sure that scholarships were available, that financial aid was available, in-state tuition, things like that. But we're also really concerned on the refugee side. A lot of the families, I learned more in the past year than I thought I would ever learn in the refugee community. But we've brought a lot of refugees into Utah, certainly in the last year, from Afghanistan and from Ukraine in particular. Problem is, most of them get a 60-day window, and then you're on your own. And we'd stop providing services at that point. And one district, for example, the Murray School District, had a big concern. Right across from the mothership, IHC, they had an apartment building that was mostly refugee families. And the tax credits ran out, the building got sold, the new landlord's coming in, and he's been open about it, that I'm gonna upgrade the building and turn it into regular apartments. So their whole refugee population is being dispersed in the Murray School District, and they're having trouble finding out where they're moving to and keeping in touch with them. So a lot of issues facing those, and going back to your earlier comment, you know, when we bring up the term immigrant or undocumented at the Capitol, it's almost like you're cursing at somebody at times. But it has to be talked about. And, you know, our population has changed as a state. We're 20% Latinx at the moment and growing, but we're also seeing other populations come in. You know, we have talked to GOED and other government entities, which is, where do you expect your workforce, if we continue to expand as a state, if we don't bring in immigrant populations to work here, where does our workforce come from? Future workforce. So they don't have an answer to that, but they just don't want to talk about it.
So I have found in my interactions with Utah government, legislature, particularly in the governor's office, they've got a soft place in their heart for refugees. They do take care of the refugee population, but it's immigrant population that they consider to be a pejorative.
There's a book I highly recommend. It's called Caste, if you haven't read it or if you have read it. And as I read that book, it reminded me of Utah and exactly what you're talking about. Like within the immigrant refugee community, the caste is, and even within the refugee community, is good refugees, better refugees. But then when it's immigrants okay, mixed status immigrants, undocumented bad, right? So they have this pecking order depending on the conversation. It's really a challenge. I have a son who's doing refugee work overseas right now, so I called one of our congressmen, and he was doing some work in Myanmar. And I asked him about, you know, what we're doing with Myanmar, is there anything we could do? Because he was heavily involved in Ukraine. And he literally said to me, yeah, we don't do Myanmar at the moment.
So your son's in Myanmar? How did an American get into Myanmar?
We don't want to talk about that at the moment. It's a week by week thing. He's keeping his mother awake at night. I'll put it that way. But your point's very valid. And that's something that we have to start, you know, it has to be a consistent message that this is, if we're going to talk about one Utah, we're going to have all these like platitudes that they throw out all the time, then we really have to like own it and start talking about it that way. I'll wrap this part of it up by saying, when we're talking about community-driven solutions, what we've done right now is one of our, we have this data savant. So she took the change in free and reduced lunch populations for every elementary school on the Wasatch Front from Box Elder to Utah County, comparing 2000 to 2019 and what the change was. And we've created a roadmap with that. And what's been really interesting about it is nothing significant in terms of like that would shock you, like this, you know, there's poverty on this side, 515, there's not on this side. But one thing we found was that for the first time ever, we're seeing areas of concentrated poverty in the state of Utah. We've never had that before. And we're trying to look deeper into that because there is a link with as the LDS population has shrunk, in certain areas, we're identifying that the population has shrunk in those areas. The support services from the church are not as predominant in those areas, and we're seeing the poverty levels climb. So that's one thing we want to look at. But the other thing we want to use that map for is we'll look at, we've agreed to look at Salt Lake, Provo, and Ogden as our first 3 pilots. And we're looking at it and saying, okay, if we know that I'll pick on Provo because they're not here. But if we know in Franklin Elementary in Provo, they have 95% free and reduced lunch, that's a good starting point for us to go and sit down and meet and bring in people from city government, bring in people from school district, bring in people, in that case, BYU's agreed to come to the table and sit down and say, okay, what are some things that we can actually get fixed at the local level now with either some more resources or a coordinated effort? So I'll use Medicaid again as an example. Franklin Elementary, 95% free and reduced lunch. We know there's a high probability those families qualify or could qualify for Medicaid or CHIP. So we'll bring in Take Care Utah with the Utah Health Policy Project and get them to do the enrollments for the families on site. That way, if other people from Provo want to come to that site, that's great. But we're going to go with the highest probability to start off with of where the population is. And then also talk about things like, it became a headline over the past few month or so, school lunch debt. So we got one of our legislators from Provo because Provo had a high lunch debt, so not surprisingly. He's already filed a bill that school lunch would be free for all children next year. And he's a Republican from Provo, so that was a nice cross-border solution, hopefully. But we think we can make inroads at the local level without the support of the legislature in some cases. Another idea we're talking to a lot of school districts about is school districts do provide services that you mentioned earlier that are eligible for Medicaid reimbursement, but they don't have anybody on staff who knows how to fill out Medicaid paperwork. Jordan is piloting it right now, and Granite is piloting it and having really good results. So they've hired a full-time person to process Medicaid reimbursement for the school. The nice part about that is the school can then reinvest that money into more counselors, more nurses, more support staff, if they so choose to. A side story I heard about that Ronald McDonald House over here on Temple, they never did it before. And one of their board members heard about this, and actually they started doing Medicaid reimbursement for Ronald McDonald House. And the first quarter of this year, they recouped $500,000. That was just.
I wanted to ask a quick question on this. This is Everett Bacon. So,
Sure.
I kind of work and represent more of blind, print disabled individuals who aren't able to like fill out a form, or maybe it's not accessible or things like that. Do you have anything in place like that to work with individuals, families who might be facing that type of challenges?
We don't as an organization, and I probably should have said this earlier, we don't run any programs, but what we do have are partners that have, it's their mission to do that kind of work. So for example, Utah Health Policy Project is somebody I could put you in touch with. They receive funding for Medicaid enrollment, and they have people that will actually go on site, sit down with people, fill out the paperwork for them, meet with them. And that's, you're absolutely right. That's a huge challenge for your community because the paperwork is cumbersome for anybody to fill out. And they certainly, I always ask the question, is the intent to actually get people enrolled or not get them enrolled? Because if you look at the way our system works here, I think the intent is not to get people enrolled. But that's a good example of having conversations like this. So if you were to say to me, we'd like to be put in touch with UHPP, set up a time to meet with them, see what kind of enrollment we could do. That's where we would make that connection, because there are a lot of these resources that are not utilized in the community at the moment that we just need to connect two people with each other. So
Does the, when you were mentioning Medicaid, does that also include Social Security or Social Security disability insurance?
I don't think, I'll have to check what UHPP is tasked for. I know it's Medicaid and CHIP. I don't know if they have Social Security or disability, but I could find out for you. I'll get back to you.
Thank you.
No, absolutely. So in the book, and I'm going to point out a couple of things and then I promise I'll stop. But, you know, some of the things we've looked at, and this is Salt Lake County, and if there's anything in the book that you specifically want to ask about Salt Lake City, anything that's in this book, we can pretty much get down to a zip code. So it's not even just Salt Lake City, we can go into a community, into a neighborhood. But, you know, some of the concerns we have is free and reduced lunch this year. Salt Lake County is going to be close to 35% of the total population. That's a high number. I mentioned chronic absenteeism earlier. Salt Lake County is at 27% this year. In some areas, you know, doing better than other parts of the state. You have about 47% of Salt Lake County is enrolled in a preschool program of some kind. Majority of them, I believe, are in the school districts, whether it's Granite or Salt Lake School District's preschool programs. But that's a higher number than most of the other parts of the state because there's access to it and it's provided by the schools. 27% of the population of Salt Lake County is under 18, and about 27%, about 7.5% of that is under 5 years old. So pretty consistent with the state numbers, slightly lower overall population in terms of under 18 in the county. But when you break it down into, as I mentioned earlier, into zip codes, we see that number move around pretty significantly. There are certain pockets of Salt Lake, as we know, that are not children's zones, if you want to call it that, that it's more either singles, et cetera. And then there are other parts where that number is going to go up much higher. As far as the health, uninsured children under 19 is about 8%, which is actually a fairly lower number than the rest of the state. And that's something where hopefully we can get that number even lower here. I want to make sure the vaccination rate, because if we put that in here.
See it.
No, we have that number, and I can get that to you. Salt Lake has done well on vaccination rates historically. We're starting to monitor, some of these numbers got wonky during COVID, so we're looking at what's changed in that. In COVID, a lot of it was you did have anti-vax people, but you also had just not having access to a pediatrician's office, or a lot of people I was talking to someone at University of Utah Health yesterday, and it's like their backlog is still huge of people catching up for normal medical procedures from 2 years ago, which, you know, is a concern, but we've started talking to some of the health departments. There's more of an effort to do mobile vaccination vans on school sites at certain locations. I know Salt Lake County Health Department's open to that idea, so I think there's some opportunities there where we can get more directly, the services directly to people where they are, as opposed to them having to go find it in those cases. And then, you know, one number which I talked about earlier, which was, you know, married couple family. So this is where there's two parents in the home, and this is not whether they're in the workforce or not, but Salt Lake is at 54%. And that's low for the state. The state generally has a higher number as far as families with both parents at home. But again, that's a burden that when we start looking more at the local level, if there's one parent home with multiple children and they're working 2 jobs, what kind of supports are they, you know, are the children getting at home or not getting at home? And where do we need to do some backfill potentially there?
So
Questions?
Mo, this is an excellent presentation and in many ways, very scary and a bit depressing. I'm sure it's a challenge for you. But my question for you is, what could we do as representatives on the Human Rights Commission to advance some of the goals that you've outlined here? How can we be helpful in accomplishing your mission?
So I'll answer that with a couple of things. We had an event a couple of weeks ago, and I spoke about part of this, which is, if you do look at this as a whole, it's overwhelming, right? If you start saying, like, we're not providing prenatal screenings for expectant mothers, we're not providing postpartum coverage, all that. So as individuals, I'm encouraging people, find the thing you care about. Like, on that whole spectrum, if you care about, prenatal screenings, get involved in that. We're also working with larger groups. So, for example, Mormon Women for Ethical Government are going to make childcare an issue this year for their organization, and they just brought on somebody out of Massachusetts to work on it on their end. So breaking it down helps. The other thing I'd love to do is, and you guys can talk about this amongst yourselves, but Salt Lake, as I mentioned earlier, is one of our pilot areas where we want to look. And I've been visiting different places. So I was at Lincoln Elementary last week, meeting with the principal over there. I was at Roots Charter School in West Valley, meeting with the principal over there, to say, okay, let's pick one or two places in Salt Lake where we can all meet and have a brainstorming session just to start off with. Like, what is it that this group, for example, can take or needs from us to move something forward? What should another group be more focused on? We promise all our partners, number one, we are always going to be totally honest. We don't run programs, so we're not coming in to run anybody's program. We're not going to step on anybody's toes that way. But we'll provide policy research, we'll provide the data, we'll provide the advocacy work, and bring other groups in to help with that as well. But we really want to form true partnerships on the ground to say, if this group thinks that childcare in Salt Lake City, as an example, is something that's the issue that this group wants to take on, and maybe it's for certain communities, we'll bring resources to the table on that issue and provide as much support as possible. You've just gotten a snippet of the data that we collect. We're also partnering now in this new endeavor. Intermountain, they do the social determinants of health data. So they're going to partner with us and share their data. So the report I mentioned earlier, when we measured free and reduced lunch, we're going to take our kids count data and put it on top of that. We're going to take Intermountain's data and put it on top of that. We're going to take Belonging Utah's data and add it to it. So it's going to be a robust data set. So if we can sit down and say, this is an issue that we really care about, and that this group wants to make it their priority, then let's hone in on that. And it might be totally different than what we're going to do in Ogden. As just as an example, like Ogden has some other challenges, so they might say we want to make this a priority. But the other thing is, I want to also look at what's working well, right? So Salt Lake has a good home visitation program. It's being funded right now primarily by Primary Children's Hospital because the state pulled the funding on it. Home visitation is a desperate need in a lot of the communities I talked about. We can go in and identify problems earlier. If somebody goes into a home and sees what's going on in the home and realizes that children are at risk or whatever the case may be, we can start addressing those problems earlier. But we've then got to convince, number one, the legislature they should be funding it. But in the interim, I know there are family foundations that are interested in that area. So we want to bring them to the table and say, you know what, let's not wait for the legislature. Let's run a pilot program and expand it here.
Have you taken a look at Salt Lake City's proposed budget, Mo?
I've looked at parts of it, yes.
Is there something in there that we can advocate for that would advance the mission that we're talking about?
I wouldn't say there's anything specific in the budget, but here's one idea I'll try to plant the seed. So if you look at University of Utah as a university, you look at Huntsman Mental Health, Huntsman Cancer, Primary Children's Hospital, and University of Utah Hospital System. Just those entities up on the hill over there. They are all trying to recruit people 25 to 40 years old to come and either be professors, interns, residents in their medical programs, right? And yet they closed one of the 2 childcare centers on the campus during COVID, and they didn't reopen. I don't think anybody is taking full responsibility for childcare at the moment, right? Like it's nobody's really, and that's not to blame anybody. No government entity is really sure who's responsible for it. We have had one county, which I won't mention, which says they told us we don't do childcare.
Mm.
And it was like, really? Well, who does? Like, because I don't know either. But here's an example. So, and the mayor knows I'll say this, we inserted ourselves in the ballpark conversation. Because I said, you know, if you look at the ballpark area, why don't we put in a early childhood center on site there with wraparound services? You have the tracks line there, it would be beneficial for your workforce. It would actually be something that could be done on, you know, with private funds, even the building out of the childcare center. There's a model out of all places, Eastern Kentucky, that I shared with them, which is getting money given to them by Google and JP Morgan, because they're doing workforce training on site for the parents. So think about, like, there would be a childcare center in the middle, but the parent could then go to the DWS satellite office right there, the 4th Street Clinic satellite office right there. So you, again, bring in services where you meet the people. But going back to the University of Utah, if Salt Lake School, and this is where it gets tricky with the government entities, if Salt Lake School District is going to close 3 elementary schools, why don't we convert those into childcare centers?
I was just going to say something along that lines.
Mhm.
Right?
And then we'd have to
It's-
find workers to staff them, and we'd have to make budgetary adjustments to make sure that they're compensated appropriately.
But you've
You
taken
think,
you're potentially taking a big piece of the cost out, because again, if the city or the county, or there's a partnership that paid for the land and the building, you've reduced a lot of your overhead costs that a lot of childcare centers, you know, have to pay rent, et cetera, et cetera. So these would have to be, you know, to make it pencil out, I think it would have to be administered by a government entity,
Mhm.
the actual
Right.
physical space. But if you did that, it takes a lot off the plate. Now, I will caution, in Park City, we're having this conversation about the city's talking about putting money into childcare. And it, you know, it was one of those frustrating conversations. I sat down with the mayor and one of the council people, and I said, are you trying to solve 0 to 3 or 0 to 5? Because the school district already provides preschool, so which one is it? They didn't know. Then I was like, is it for Park City residents who work here, or is it for people that work in Park City that are non-residents? So you do have a lot of questions that have to go with it. But I think if people could be creative, and I think there's an opportunity right now in Salt Lake in particular, because of the closure of the schools, the demand, I've already heard Intermountain Hospital in Park City couldn't get enough residents this year because of childcare.
Mhm.
Number one reason. I had surgery about a month ago. My surgeon spent the whole time talking to me about the lack of childcare because her nanny couldn't renew her visa. Right? So, you know, again, this is the local level where I think we could come up with a solution, which, you know, everybody's gonna have to bend a little bit and give a little bit on it. But, you know, is the school district willing to either donate one of the sites and have the other 2 bought, and that childcare center could be for school district employees? You know, there's a lot of different ways it could be worked out. But I think whoever, I'll put it this way too, on the economic side, whoever figures out childcare is gonna have an economic advantage for the next 5 years.
Mhm.
So the way I see it, the angle that we would have as a Human Rights Commission to approach this monolithic topic would be through the lens of healthcare as a human right, or education is a human right.
Mhm.
So that's the starting point for us. So where we go from that direction as advocates for a policy or program has to be founded on on that basis. So I think equity in early childhood development towards education is the pathway that we'd be able to be advocates for something like early childhood development centers. And I would add, so I like that idea, and that was something that I was thinking along that lines. Why wouldn't the school district be able to run the early childhood centers just as well as they run schools?
They could. I mean, I think it's never been part of their mandate. And, you know, we have a good relationship with Sid Dixon, and, you know, and she's been very honest with me. She's like, I am more than happy to put pre-K into all our public schools as an example for 3 and 4 years old, if the commitment is there to fund it properly from the state.
Right.
But if it's K to 12 gets funded with the WPU, and pre-K, you gotta figure it out yourself, where it's a grant-based program, or, you know, all these other things they try to, you know, nickel and dime with. She's not gonna take on that burden and then have to go and deal with all the problems that come with it. So, you know,
I think I think the pre-K issue is, we have a facility, we have the schools that could serve as the location for pre-K. There's certainly capacity in the Salt Lake City school system. The after-school programs that the city runs can handle school-age kids, and also if they had facilities for pre-K. So I think working with the city and working with the school districts might be a good way to start to find a solution to the problem. But I disagree with you a little bit, Jason. I don't think it's just healthcare, and I don't think it's just education. I think it's economic equity. Because I think what's happened is that people of means will find a way to take care of their kids, either through private nannies, through forming their own private daycare systems, or just paying a lot of money for it. But it's the people who can't afford it that end up perpetuating a system of poverty and low income, because one parent must stay home and cannot work to take care of their kids. So I think it covers the whole spectrum of what we're about: healthcare, education, and economic equity. And so it's certainly something that I think the commission should take an active interest in.
I agree. Economic equity is a bit harder of an argument to make, or a bigger stretch as a human rights angle, just because you start getting, that's where it starts getting confrontational with people thinking that you're pushing socialism or communist agenda.
yeah, we always have to worry about that. But, you know, this is also, you know, as you were saying that, we've had good conversations with Salt Lake Community College. Salt Lake Community College really, they have a challenge. A lot of their students drop out because they can't access childcare, right? But then on the flip side of that is, are we coming up with credentials and certification programs for childcare for young students who may want to go into that area that makes it attractive, right? If you have to go, you know, I have a daughter who wants to go into education. I'm torn, but I tell her, I said, you know, if she goes into early childhood, her degree is costing her the same at the U as if she went into economics, right? And so how do we address that so that we can actually bring more people into that workforce who actually want to be in that work, you know, in that area?
There was a federal program where if you worked for 10 years in a school system that was for underprivileged, that you would then have your student loans forgiven, and virtually no one has been able to get that, go through all of the paperwork hoops and get that payoff back.
Yeah. Well, we talk, you know, one of the things, and I'll relate this to childcare, because we tried to talk about this a number of years ago when I was more involved with the schools directly, is exactly that. Why don't we have a tax credit program for people that are going into childcare or education, right? So if you graduate from the University of Utah or any school in Utah, and I would make it subject specific, so you have to have a master's degree, but it could be a 5-year program, but you could get a tax credit for every year you're teaching in a public institution. That's a benefit to everybody, including the school districts, who may be able to bring on some younger teachers and make it attractive for them to stay in the field, because we lose most of our teachers in the first 3 years. Right? So we could do the same thing with childcare. But I do think it's getting enough people at a table like this to say, are we willing to be creative? Are we willing to look at, the obstacles that might come in the way and put aside egos in this conversation? Because,
Yeah.
school districts get like, well, it's our property, and, we're looking at something else. And it's like, what is the need? What is the best use of a facility? What is the best use? School districts need childcare if they want to attract young teachers.
Right.
So,
I think it's important to build coalitions, and forming a coalition with business leaders who say, we want new legislation, we want tax incentives, we want credits, because we want people to go into these fields. We want more childcare because that allows us to hire employees, bring employees into the state, fill our workforce, et cetera. That, that might be one way to try to get some of this done.
Okay, so I'm gonna interrupt here. We're way over time.
Yes, I
So
will.
can we, does Will or Everett have any final thoughts you want to contribute on this topic?
None from my end.
So David is part of our newest subcommittee, Children and Youth Advocacy. So David, do you want to stay in touch here with Mo and start working on some of these topics?
Absolutely. Yes.
please, and I'm going to leave these books with Michelle. She'll get them to you, and they're also on our website. But any questions any of you have, just reach out to me. We're wide open, and all our data is for the public. We don't hold on to anything. As a matter of fact, we'd rather share it because the more people that see it, the better the response is for us. And
I think there's a
Thank
lot
you,
of
Mo.
good ideas.
Thank you
for
very
your
much for your time.
time. Thank you.
And I think there's a lot of good ideas and places to start. Our capacity as just a citizen volunteer group is somewhat limited. It's mainly advocacy for issues. We're not really, we don't have a lot of muscle to get things done, but we'd love to be part of the coalition, as David was speaking of. We could be at the table. There's plenty of great ideas we can help advocate for.
Well, my favorite, I'll leave you with this statistic from Love Communications. If 8 people call their legislator in Utah, there's a chance they'll change their mind. They have to say, I'm your constituent, I live in your district, and here's what I think.
But do they know that my senator is Tom Weiler?
You mean future Congressman Weiler? Well, I think it was about 6 people that got the UTA bus changed this weekend, so I think it can be proven. No, but I think sometimes it is that advocacy piece, like you guys play that role, but if we can provide you with the data to go with that advocacy piece, it does go a long way. Like, we try to stay out of like the cultural arguments and just say, you know what? This is what the data shows. When we passed the 100% kids coverage bill, I had 3 Republican legislators ask why they should vote for it, and my only response was, because you'd be an idiot not to. And from an economic standpoint, you spend $4 million and the state saves $8.8 million right away.
Why is the argument never because it's the right thing to do?
Well, we had already had that argument. It wasn't working, so I went right for the, and they voted in favor of it. So I don't know, maybe it's my new approach.
All right. Thank you.
Anyway, thank you very much. I'll let you guys wrap up your meeting.
Thank you, have a good night.
Yeah.
Yes, I'll wrap.
Okay,
Thank you so much.
thank you.
Thank you, Mo.
Thank you.
So Olivia joined us.
Yes.
Didn't notice. I would have asked if you had any questions, Olivia.
Oh, no, thank you so much, Commissioner. No, I'm good to go. I thought it was really informative and y'all were asking great questions. And I did get here late. I apologize.
All right, so let's try to move on the agenda. We have so strategy planning session. When we had our other guests speakers had to drop out at the last minute. Kind of came up with an idea that I think that we have a brief discussion about what do we want to do with the Human Rights Commission? Because we're kind of still following a model from mid-COVID days where we were kind of limited in what we could do, and there were some personality conflicts on the commission that limited our ability to come to consensus on anything. Now that COVID is behind us and some of those personalities are no longer on the commission, I think we can reevaluate and figure out what direction we want to take. And rather than just throwing that question out there into a void, I can say that when I first joined, there was a lot of letter writing and advocacy on issues going on, where the Human Rights Commission would write a letter in support of something and submit it, or there would be a drafting of opinion pieces, op-eds, letters to the editor, targeted letters to specific legislators or the governor's office, where we use the title Human Rights Commission of Salt Lake City to try to be more forcefully advocate for things. Then I think 6 of the 7 commissioners resigned in the course of about 6 weeks, and that kind of just fell away. So that advocacy letter writing, taking positions on issues faded and became more of advising the mayor's office or advising the city council on specific topics or long-term projects. So anyway, I want to throw it back out there because I'm only around for another few months, so it's going to be in your guys' hands after that. What do you want to do with this commission and with your in your capacity as a commissioner?
So this is Everett. So I like the idea of being more of an advocate. I think the problem for me is we hear these discussions, but we don't know what we can do to progress things further, or what the city council or what the mayor's office would like us to do. So it would be nice if maybe we could set up a meeting in August where we could sit down with the mayor or someone from the city's council and really hear what they would like us to do for them, because and for the people of Salt Lake. I think that's where I'm a little not clear on what purpose we can really do and what our purpose really is.
Okay, so Everett, while we are appointed by the mayor and confirmed by the city council, we are a citizen commission that is independent of both bodies. We just advise them that we're not a tool under their umbrella. We're not a body under their umbrella. We're separate, and our purpose, I think, by what's the word I'm looking for, in the rules that the city follows by city code, is that we are available to advise them, but we're independent from the mayor and we're independent from the city council. So let's keep that in mind, though, that we can go to them with an idea of we would like to be more forceful, or we'd like to be more advocate oriented, or we would, anyway, I hope that kind of clears things up a little bit. That we've become a little bit passive because of all the great support that we get from the mayor's office, but we don't have to be.
Well, I think the
Go
area.
ahead, my bad.
I'm sorry. I'm sorry. I'll finish up. The thing, I think the area for me is I'm not really sure what I'm all for, being a rebel rouser. I can do that when it's needed, especially with regards to disability rights. But I got to know a direction and what really we want to go. I'm doing that with the Accessibility and Disability Commission, but where I can help on the Human Rights Commission, I still am not quite clear, and I want to do more and want to know how I can do more. So
I think I can help explain that too. That's kind of why we have the subcommittees. Like before CEDAW became a policy, like they worked really hard. It's just kind of, you all, I think where Jason's getting at is you all kind of have it in your hands to be proactive. If you want to provide policy recommendations, Like, let's start the talk and conversations now. I think before we lost our commissioners who were very passionate about the refugees and New American Subcommittee, I could see it going in that route, but now we're kind of restarting from scratch just based on the experience. I can see the subcommittees and we can expand it or we can remove them, whichever you feel like it gives it more purpose, if that makes sense, but that's kind of where we can go with like, okay, we're under this subcommittee, what policy can we look at within Salt Lake City? You can pass things as big as code and get it into ordinance, or as small as trying to install something within the city, like a new initiative. Kind of, that's similar to the ADC. I think the ADC accessibility, and Ashley says this all the time, it's kind of like low hanging fruit. There's a lot of things that the city was already missing. So it's like for the ADC, there's things that you all need to do and you all have been accomplishing great things because the city didn't have it installed. So think of the Human Rights Commission in that sense as well. What are equitable practices we can look into? And things like that, just to kind of get the wheels turning on things you all can do.
So an idea I had, since we are in Pride Month, would be, we've seen the trans community come under like just relentless attack over the last 6 months to a year or so. It's become one of the hot button culture war issues. I think that it would fully be under our purview, our umbrella, to write an op-ed as the Human Rights Commission to lay that out and raise like a caution of advocacy in favor of equality, support of trans brothers and sisters, that this is their moment in the spotlight and they are getting unfairly attacked, something along that lines. I mean, that's low hanging fruit where we could, during Pride Month, take a stand in favor of trans rights. But I don't want to be leading out on something if that's not, if I don't have buy-in from everybody on the commission, that that's something that you're interested in doing. Because I've drafted many letters and I've drafted many over the years, it went nowhere because there wasn't consensus.
Well, I thought you were asking a bigger question initially, Jason, which is what is the role of the Human Rights Commission? I see it in two ways primarily. One is information gathering and dissemination. So far this year, we've been doing a lot of information gathering on accessibility to housing, on homelessness, and now on childhood and youth education issues. That's all been in the nature of information gathering so far. And we could continue in that vein, gathering information on various topics, including transgender rights that you just brought up, and make reports to the city about what we've learned and share that information with the city council and the mayor's office. Basically sort of being a clearinghouse, if you will, of information from various sources that involve directly or indirectly human rights. Alternatively, we could gather information, but then advocate by writing opinions, going to meetings, meeting with legislative leaders on behalf of the Human Rights Commission and saying, we've looked into this issue and here's where we think you should be going or thinking. This is our position. So I think the discussion we need to have now is, and there may, and I don't want to preclude other avenues or missions for the commission, but I think in my thinking, we have those two pathways: information gathering and reporting, or that plus taking positions and advocating for certain outcomes. I am in favor personally of being more than just a clearinghouse and an information gathering body. I think we need to do that because we want our opinions to be informed by data, but I think we should also advocate for outcomes that we think benefit the citizens of the city and advance human rights for those residents. So that's my position. I think we should be more of an advocacy organization.
Agreed, and I wasn't trying to limit it just to the one topic, it was just my idea of a way we get started in that pathway with something easy during Pride Week, or Pride Month, to take a stand on this issue and make a public statement, because we haven't made any public statements in a few years. So, anyway, that's an idea I'm throwing out there, if somebody wants.
Well, I'd
This
like to
is
hear,
Everett.
from Will and Everett and Olivia on this topic, because we're all kind of in this together.
I think
Well,
this. Oh,
sorry.
Everett.
Go ahead. No, go ahead, Olivia.
Oh, okay. I think this for me is something I want to think on like a much broader, because I think that we really can do a lot. I mean, I'm fairly new to this commission, but as far as advocacy, I mean, that could look like a lot. I feel like it sounds like, you guys used to come out with a lot of statements, and as important as that is, a statement really is just a statement. I mean, I would love to see us maybe meeting with lawmakers more, and I know you mentioned this, and going up to the Capitol and or different municipalities or whatever it may be, and actually being there presently and like building relationships with some of these individuals on these various issues. And then that information gathering piece of, so that our opinions are informed. But even I would almost like to know, like, what did the commission look like when it was at its, highest and most functionable, and like just kind of meeting with people who I would just like to see what we've done in the past and to have a greater understanding of that.
I think that maybe we could ask City Councilman Wharton to come and give us an overview of that, because he overlapped with me briefly, but he knew it at its height when back under when Ben McAdams was the senior policy advisor to the mayor. They used the Human Rights Commission to hold public meetings and really push for the non-discrimination ordinance. They were a very, very instrumental tool in getting the non-discrimination ordinance passed on the city level, accepted by the legislature with the backing of the LDS Church, or the Church of Jesus Christ of Latter-day Saints. I think that's what we're supposed to say now. If we could try to get probably post-budget negotiations, if we could get City Councilman Wharton to come in and kind of give an overview of the history of the Human Rights Commission of Salt Lake City, that might benefit you guys.
Yeah, I agree. That would be beneficial. Yeah.
I would like that a lot, yeah.
Because I've been here now for 7 years, but I can say in that 7 years, there's been a lot of trials and tribulations of having to rebuild from scratch twice, and then COVID. And so my experience is definitely not normal, and probably not, it's more cautionary tale than I think it is beneficial of how things are supposed to be run.
Yeah. Olivia, what's your view?
Am I good to go? Yeah. I want to know what we were doing before, and I mean, Jason, Commissioner, so if you've been here the longest, I think it'd be great to hear your insight as to what you feel is the best item or topic that the commission is best at performing, since you have the most experience, and I think that's a good starting point.
I enjoyed the advocacy more than as Commissioner Lita pointed out, the information gathering and disseminating information. I believe we've probably been the most effective in my time at getting CDOT passed as an ordinance, or getting adopted as an ordinance, in being able to work with the mayor's office in implementing a bunch of standards when it comes to equity and measuring whether or not they're meeting equity requirements in different departments. So I think we've been probably most effective at that, but the issue advocacy is definitely more fulfilling.
Yeah, and this is stuff that we have to do with CDOT as well, right?
I'm sorry, I couldn't understand you, Olivia.
I know there was some other things that we still had to finish up with CEDA. I know there was we started a committee and whatnot.
Oh, it's not, it's ongoing in perpetuity, that this commission has to be the oversight body for the implementation of CEDAW and making sure that there's every 5 years, there is an equity study that takes place. So, I mean, that's part of now our mission in ordinance. So CEDAW's never going away, but I think getting that passed as an ordinance puts us on a list of only about a dozen cities, somewhere between a dozen and 20 cities in the country. So that was a heavy lift that took 10 years of work. And I was just saying that of things that we've accomplished, that's probably one of the bigger things.
Yeah, and yeah, thank you for that background. And I think that's a really good starting point. I'm sure we had debriefs on everything that we did and whatnot, and I think we can take that as almost as a blueprint as to how we can affect other areas in our city.
Understood. I agree. And I think getting some more background on what the Human Rights Commission did with that non-discrimination ordinance would be beneficial too, because I think that's more the model of how this body was envisioned. But that was way before my time, so I'm not really sure that institutional knowledge didn't pass down to me.
Yeah, I think I mean everything that we did with CEDA, I think that would be great. So we were able to repeat that success, and even build upon whatever we are doing with CEDA. Yeah, those are my thoughts.
This is Everett. I also am wondering how many seats do we still have open on the commission?
2, but I think we filled one of them.
One's getting confirmed tonight, and I'm gonna send in the other confirmation this week.
Oh,
So we might
excellent.
We might be at full capacity for the first time.
Yeah, that's great. Yeah.
Good. Finally.
So one thing, as you were talking, Olivia and Jason, both Will and Everett as well, that occurred to me is on the subject of transgender rights. That is something that seems to fall often in a gray area. I wonder what people think about if holding hearings, actual hearings, investigative hearings, conducted by this commission, where we bring in people to take points of view or hear from them on points of view about transgender rights, about access to sports. That's a huge hot button issue. As to whether, I think there's a lot of boogeymen out there about the impact that trans people will have on sports, making it unfair for them to participate in certain sports. And access to public facilities and things like that. I wonder if we actually could do something important by holding hearings where we gather information from people, hear different points of view, and then based on that, write op-ed pieces or actually advocate for certain legislation.
Go ahead, Will.
David, I absolutely love the idea of holding hearings, and I think that this is something we could do even broader, just beyond transgender issues. Asking people in the city kind of what do they think is going on, and what are the gaps that they think need to be filled in the city right now as far as pertaining to human rights. I like the idea of making it broader, maybe. Maybe we just don't know what we don't know, and inviting more people to the conversation from the city could be helpful, but I just want to know your thoughts on that.
Okay, that sounds interesting. If we're doing a data collection, it can't be too broad, but if we're doing something like a listening session or trying to collect narratives concerning quality of life issues, then we don't have to worry about quantitative data collection. So that's kind of maybe we're talking about the same thing with different words, but yeah, it's probably something for us to think about and and communicate with offline, because I think we're getting close to end of time here.
So yes, just to kind of wrap up this, I think this was perfect in terms of what Commissioner Wessel wanted to get from this session. It was the point of, we're not going into specific topics, but it's just, what I'm hearing is that everybody is kind of leaning towards the more advocacy. I will reach out to Councilmember Wharton. If any of you know Kilo Zamora, there's different people who served on the commission right before, I think, Commissioner Wessel's time that, again, passed things like the non-discrimination ordinance, started the conversations of CEDAW, so I can try to bring them in. We did have the Thriving in Place study reach out, community and neighborhoods, and they do want to come to our August meeting. They wanted to come today, but by the time they reached out, this was already finalized. So since we don't have a meeting in July, we scheduled them for August, but I am happy to ensure we have that other perspective.
Thriving in Place is the body that's dealing with gentrification studies, which is really important, but the couple of times that I have heard from them, there's not really anything for us to do other than collect the data.
Well, I will send an email. They have like public comment time period. So that ends on June 26th, I believe. So I will get that out to you all so you all can respond. Like it is actual to-do items.
Oh.
They asked to come to the commission meeting. So
Okay, I just know
it's just
that
like,
it's been a couple year process. And
Yes.
every time we hear from them, it's just more of an info dump than anything else. So
yes.
if they've got something actionable, that's great. But I just want to make sure they're not the only people on the agenda.
Well, are they asking us to make a
Oh.
comment by June 26th?
Well, I will send you all the email. It's just like a specific blurb she has here. I don't have it up right now. I will literally send all of this in a follow-up email and provide that information to you, but they are requesting to come in August. So.
Yeah, if well, I'm happy to invite them to come. Doesn't have to be the only thing we do in August, but if they've got a particular proposal and they want us to comment on their proposal, and if the deadline for commenting is this month, we really need to get working on that.
If my understanding
It's all
from
individual.
hearing from other venues is that they've got an online survey that they have out there that they'll probably close at the end of June. It's one that's been open to the public for a few months now. It's not us specifically that they want to participate in their survey. It's open to the public one where I think they've got hundreds of people have responded
Yes.
so far.
So you all can respond individually. It doesn't need to be like the commission says this. I will send it to you all. If you choose to respond, you choose to respond. But they will be coming in August, and I'll figure out with the chair and vice chair what else we have for August. But yes, I hear what you all are saying, and did we still want to go through, I know subcommittee?
Is this the Thriving in Place survey where they talk about different densities of housing, different modes of transportation, different forms of open space? Is that the program?
That's their presentation. Their survey
Okay.
is a little more quality of life questions about.
Yeah.
Transportation.
I completed that survey, so I'm aware of what it is. I'd be interested in the results of the survey.
Yes. All right, so, yeah, we'll put a pin in the strategy planning session thing. Let's communicate via email about some of these ideas that we have. I think Will's idea was great. David's idea, if we can find the middle ground between those two about between data collection and more of a broader listening session, I think that would be a great initiative for the Human Rights Commission to take up as one of our first public acts in a few years. So yeah, let's let that drop. Let's take that conversation online. For the subcommittee goals and priorities, I don't have a whole lot to give. The racial equity and policing was all about the budget request. not really any reason to go into details on that if the budget isn't finalized yet. Do we have any, let's see, the Salt Lake Valley Commission to End Homelessness is in a reorg. The first meeting they're going to have after the reorg is next week. So there's nothing to report on homelessness. I think we focused on children and youth advocacy, unless you've got something you want to add, David?
No, except, youth advocacy ranges anywhere from 0 to 18 years of age. And I think we have decided that probably we need to pick an age bracket to focus on. And we decided to focus on preschoolers, so 0 to K. And from what I'm hearing, that is a pressing need because of the absence of adequate childcare for those young kids. Once kids get into school, it's a little bit easier on parents because the school is an environment that's safe and educational. There are after-school programs, but it's the preschoolers that present a problem, especially for young parents. So if we can figure out a solution to that, if we can advocate for those solutions, I think that will be a worthwhile objective.
I do like that idea of trying to find some way to open youth resource centers or early development post term. Anyway, that's a good one. Refugees and New Americans.
We're not, so both these subcommittees, Children and Youth Advocacy will be meeting on Friday, and then Refugees and New Americans will be meeting on Tuesday, so we can provide an update in August.
Okay, and I believe that we decided the gentrification, taking that off the table just because we didn't have, it requires a level of knowledge and expertise that we don't have
I
currently.
believe Will did sign up to
Oh,
be a
sorry.
chair and express passion in it. Will, did you want to give an update if you have one?
Yeah.
I apologize, Will, I completely forgot about that.
Oh, you're totally good. Don't even worry. I will be honest, it is not somewhere I do necessarily have all the knowledge in that area, but I did meet with Ivis Garcia, who formerly chaired, and she provided me a lot of good info. She was kind of just talking about CEDAW and everything that was going on there, but also she gave me some names of some contacts because she didn't really get to see the Thriving in Place things and how it ended up, what the results of it were in the end part of it. She gave me some contacts to reach out to, some professors up at the U. So I've been kind of slammed with pride and everything going on, but I plan on reaching out to them the next week. And I think right now I'm just kind of learning some of this stuff, figuring out what's done in the past, and really trying to ask more of the experts in this field about, potential things that should be on our radar or on my radar in general. So I'm kind of just learning, honestly, because I don't have the expertise. But
There's no better source on that topic than Dr. Garcia, so.
Yeah, she definitely knew what she knows what she's talking about for sure.
Thank you for doing that. And there's definitely like no rush on that learning period, since right now you're the only one who has showed interest. So we do appreciate you doing that. I did just want to update you all on Human Rights Day as well. We did decide it will happen on December 9th, Saturday, December 9th from 12 to 2 at the Gallivan Center. So we are working to that. This Human Rights Day being the 75th anniversary, it is going to be a big event. Right now, my intern is working on a lot of the groundwork behind it, but I will be giving updates, I guess now at our August meeting, since we have a recess in July. So I'll provide updates via email. If you want more involvement with Human Rights Day, please reach out to me via text or email. Right now, it's probably going to be the chair and vice chairs, in the sense that I meet with them regularly anyways. But the commission, you're more than welcome to help in any capacity. But it is.
Hey, Michelle.
Yes.
Michelle, this is Everett. I have a lot of experience planning events and things like that. So, count me in for that. I'd be happy to help with that.
Okay.
And Michelle, let me just reiterate, it's at the Gallivan Center, December 9th, from noon to 2 p.m.
Yes.
Thank you.
We decided a luncheon was a little bit better in December than trying to do dinner again, since everybody's running from event to event in December.
No, I think that's a great idea. And you're talking about the Gallivan Center indoor space, right? Obviously.
Yes, yes. Also, it's the 75th anniversary of signing of, anyway, it's a big deal, so we're gonna try to make it a big deal this year. Yeah, and also, while we're on the topic of meetings with chairs and vice chairs, since both Esther and I are going to be gone after December, that leaves us with leadership turnover. Olivia is vice chair right now. David has expressed interest in being a vice chair as well, but since it's not on the agenda, we'll have to push this to the next meeting where we can hold a vote to. Basically, I'm saying if anybody else is interested in being vice chair, then we can have an election. Otherwise, because there's been no public announcement of it, and we couldn't really even adopt it now at this meeting. But I want to put it out there that we want to get another vice chair in there, so there's 2 people to take over next year. David's expressed interest already, which we really appreciate, but for the sake of transparency and fairness, it's open to anyone on the commission who is interested in trying to fill a position of vice chair with the expectation that they'll be taking over as chair and vice chair starting in January.
Okay, so for clarity on that, so right now on all documentations, it's just you and Esther, just because of how the commission runs. So when we vote them in, is this like people training, like shadowing, but we're voting them in? Because we still do a formal vote for chair and vice chair in January.
Yeah, my understanding is that we don't have any requirements on how many vice chairs we have. So we can have Esther's vice chair on paper, but so is Olivia, so will the next person that we adopt, but who we vote for. But I don't know. We'll have to look at the ordinance closer. But
yeah,
I had the impression, Jason, that you and Esther were co-chairs, that Olivia was the vice chair, and I would propose that if that's true, that she be the first vice chair and I'll be the second vice chair. So that
Esther and I haven't really been formal about things too much. She was chair last year and I was vice chair. And then when she needed to step back for going to law school, I became chair, she became vice chair. It's really, I don't know, trading deck chairs on the Titanic. It's not important to us.
yes.
With the titles, it's not important to us.
Unless Olivia has a vehement objection, I would suggest that she be next in line to chair the commission, and that maybe I be after that at some point. And I'm happy not to even be that. If Will or Everett or some new member of the commission has a passion to do it, I've got plenty to do. So, you know,
oh, sorry, go ahead.
No, I was just saying, I was feeling the last time we discussed it, that there was a void, and to avoid a void, I was happy to step in. But if someone else has a real passion for it, I'm happy to step out as well.
So I think as Michelle was pointing out, a vote happens in January for the leadership positions. So it's up to you guys in January, who's chair, who's vice chair. If there's multiple vice chairs, if you want to have a secretary and a treasurer, all that kind of stuff is up to you. But the vision I had is that with both Esther and I leaving in January, we want to have a couple of people up to speed on how things work, so they're ready to hit the ground running. And that means participating in the chair and vice chairs meetings. Olivia's been to a couple of them so far. I don't know if Olivia might be deciding to just sneak out the back way after seeing how those run. But basically, it's just so that we don't end up having a steep learning curve when when I'm gone, when Esther's gone, I mean, you can still always ask us questions, but I will say the first 2 years I was on the commission and we had to replace 6 people were really hard. And I don't want to leave anybody in that position.
Yeah, can I interject real quick, Commissioner? The only thing I want to say is, that's kind of why I made that point about CEDA, about let's learn what we're really good at so we can move forward on that, because we are going to have leadership turnover. And I think, I mean, we have Commissioner Bacon, Commissioner Lita, Commissioner Terry, I think, and then whoever we bring on board, I think we're going to have a great team. And if we can just start from a place that we're already good at, then we can branch out from there.
All right, sounds good.
What would help you all? Like with the Racial Equity and Policing Commission, we're installing, well, we just, for our end of year report, they're requiring an annual retreat where they learn about these different things, because with their 2 years, they have high turnover rates as well. So with the HRC, I guess I never had to think about that because we always had someone with institutional knowledge here. It's just all about your time commitment. I can make it happen. If you all think a retreat and orientation is needed, Jason has all of these binders and information.
I don't, I gave this.
Well, yes, I have them, but yes, just what is the best way to learn? Because in these meetings aren't the time to learn information, if that makes sense, because we're just in the rhythm of the meeting. We have a presenter, we have to go about our voting.
I would
So
be in
what-
favor of an in-person retreat.
I second that.
Okay, so I will send out does a certain time frame work? Like I need a month that works for you all, that you all will come in person. Cause I will work hard to plan this, but I need you all to meet me halfway too.
Well, I'm happy to do it in July. We don't have a regular meeting. We could use July. I know people go on
July
vacations.
is a really tough month. Yeah, July, I say I can't. So,
Oh, okay.
because you've got vacations, I've got conferences, and then you've got the actual ADA celebration. So I just, yeah,
Okay,
I would
hear ya.
prefer later than that.
Michelle, what if you sent out like a doodle poll with some dates for the rest of the year, and we could all respond in our email with just some dates that may work, and you could go from there.
That's a great idea.
Yes.
Yeah,
just
I
wanted
like
to
that idea,
narrow it down just a little. Like, do you guys?
Yeah,
want me to put all
let's
Sunday
find,
through
how about a doodle,
Saturday?
how about a doodle poll that takes us just through the end of August? And let's see if we can find a date. And let's talk about maybe a lunch meeting. How's that? Will we get together in the middle of the day? That's a real problem for people. Let's see if we can find a lunchtime between now and the end of August where we can get together for the specific purpose of having a retreat to talk about the issues that Olivia raised.
So when I hear lunch meeting, I hear an hour. Who has more than an hour for?
I would propose like a weekend, so we would have a couple hours, maybe like the next Saturdays or Sundays. I don't know if anybody has hard times on Sundays. Or
All right,
Saturdays.
so let's
Let's
modify this then to take both ideas. Let's do a doodle poll of weekends in August or September.
Michelle, how much time do you think you need to catch us for the retreat on your end?
to plan for it.
Well, no, just like a time for us to sit down, like enough time so we can absorb the information.
I mean, Jason's.
It'll be
sitting
more than
here.
an hour.
Yeah, probably more than an hour. Like our retreat for the Racial Equity and Policing Commission, I'm requiring 4 hours of their time.
Okay.
And I'm
that-
providing them food, but they know that, again, it's in the same situation that the HRC's in. They're gonna lose the members who are core commissioners from when it started. So for them, we need to understand, because they follow a 100+ page report of information that even I'm still learning to grasp and being new in this role. So if you all think we can do it in 2 hours, then that's fine. I'm just making a day out of it.
Let's try to find a 4-hour block. I think a 4-hour block is good. Beyond that, people lose attention. Interest wanes. 4 hours is probably max, in my opinion, having been to a lot of retreats. If we're going to do this, though, and if the purpose is to transfer institutional knowledge, I think we ought to try to invite people who were former commissioners so that they can also share what they learned, the good, the bad, and the ugly, as well as just get the existing commission together.
So I think we can, we got a few people, besides, Chris Wharton,
Kilo Zamora for sure.
Kilo Zamora is a good one. Trying to think.
I'm sorry, I'm gonna have to step off. It's 7:30.
Yeah, we're at
so-
that,
okay.
we're already over time, so let's
Okay.
just, conclude the meeting and,
And I'll touch
continue to
base
talk
with you.
informally. So, entertain a
Thank you.
motion to adjourn.
So
So
moved.
moved. I'll
All
second.
right, we have a motion in multiple seconds, so we are adjourned.
Okay, thank you all for your time. Enjoy July off.
Thank you. Bye.
Bye, everyone.